As soon as we celebrated 2020, the global healthcare industry faced the biggest public health challenge of a generation. Healthcare industry was threatened by COVID-19 pandemic. The COVID-19 has brought global healthcare systems to rush into addressing the healthcare needs faster than the pace of spread of virus. Even though governments are calming the spread of the virus, health workers, particularly women, are on the front lines of pandemic. In the midst of this situation, it is comforting to know that these staff are there to provide care and guidance. Conversely, with more than a shortage of access to essential health services, what happens when there are not enough doctors, nurses, and support staff? Today, I will discuss how AI is preparing the healthcare industry for a post-COVID-19 world. But before we get started, please hit that like button, click on that little notification bell so that each time I upload a new video, YouTube notifies you. Also help us grow and subscribe to our channel called MONET Blockchain and AI. Given the magnitude of pandemic we are living through, the burden on the frontline healthcare workers is obvious to everyone, but the burden on leaders, whether on the front line or operating away from the spotlight, is equally acute. Apparently, there is a loud and clear need to increase the number of healthcare workers and enhance the skills of healthcare workers, particularly the frontline staff. For that reason, it would be wise to use emerging health technologies, including artificial intelligence, to improve the capabilities of healthcare providers. That being said, what's even more needed is an assurance that an ethical and secure approach is applied to the development and use of digital health technologies, and also that ethically appropriate training is given to improve the ability of digital health technology, leading to an overall stronger healthcare system. Therefore, at the speed at which virus spread left patients and governments blinded, there weren't many choices left for the researchers or policymakers, etc., to divert their full attention and resources towards addressing the challenge of spread of the virus, finding solutions, and assessing the impact different solutions might have on suppressing the spread of the virus. Needless to say, the very, very obvious question is, how do we go about attempting to bring COVID-19 under control? The healthcare sector is getting increasingly reliant on the help of technology because there is an urgent need to respond to the COVID-19 pandemic, which push governments, healthcare providers, and businesses to strongly consider the applications of artificial intelligence to compensate for the unavailability of human workers. For obvious reasons, this makes sense pretty much because AI claims to make workers' job easier. So I believe it was, and it still is, the perfect time to test how far AI can take us to address the changing needs of various industries, specifically the healthcare. I'll take a little diversion from COVID to another major disease that many people had lost their lives to, which is cancer. Let's see how AI had already disrupted the diagnosis of cancer, and if AI can address the challenge of a terminal disease such as cancer, then it's a truly hopeful situation where AI can be extremely helpful in fighting coronavirus too. In Europe, the number of cancer cases continues to grow, while the number of trained pathologists declines. For those who may not know who a pathologist is, pathologists are people who can spot cancerous cells in a human body. Traditional pathology asks a GP or your family doctor to take a tissue sample from a patient and send it to a laboratory for examination, where it is manually placed on a glass slide, studied by a human pathologist under a microscope. Now we need to really understand this. A pathologist, with all the training in the world, is a human after all. He or she gets hungry, gets thirsty, gets tired, wants comfort breaks, and sometimes even more than we may realize, makes misjudgments and mistakes. Ironically, perhaps the most basic and obvious task, the identification of cancer cells, is what the task-based AI is almost ideally suited to perform. Unlike humans, AI never gets tired, and if the algorithms are correctly programmed, behaves with extreme accuracy and precision. Artificial intelligence can interrogate several image databases so that when a clinician identifies a tumor, the database can be searched to find all related tumors, hence permitting the human pathologist to assess the treatment and subsequently the outcomes prior to designing an effective and bespoke treatment for the patient. The goal of AI in this example is to relieve mind-blowing, time-consuming, repetitive work, in this case looking at a microscope, and free technician to concentrate on providing human-friendly, work-oriented, tailored medical care for the patient. So how does this example of AI detecting cancerous cells with much more efficiency than human correlate COVID-19 crisis? It's really important for us to understand that any technology evolves over a period of time. For example, computers today evolved tremendously from the computers we knew back in 1982. This means that any digital healthcare company had been previously investing and working on solutions concerning digital health are the ones today who are almost ready to take off with offering solutions for a post-COVID-19 world. Since my focus is on AI in healthcare, the AI-centric healthcare providers are now ready, in my opinion, to offer solutions that concern, say, instant updates on COVID-positive patients within a certain radius, or drug discovery or database technology. As an example, within drug discovery domain, AI tools can learn representations such as images based upon existing drugs, permitting scientists to find new drug-like molecules with the potential to heal the disease, such as coronavirus. Furthermore, an AI-based approach can lessen the initial phase of the drug discovery process from several years to a few days, thanks partially to its capability to make most of several drugs' characteristics side by side and very, very fast. Let's see another example within database technology. When it comes to AI, data is everything. What I mean to say is, in order to better understand disease such as corona and maybe combinations of diseases, AI connects the data that are by definition related to each other. So under the heading of database technology, AI tools look for the hidden insights behind the newly connected data. What's further done is inclusion of pattern recognition through a combination of graph technology and machine learning. Graph database technology helps researchers connect highly contrasted data from various disciplines, species, and locations in order to create a hugely valuable body of knowledge. This is done by means of connecting public knowledge with the internal data, enabling scientists to find hidden connections between the data. Conclusively, a lot of valuable work is being done as we speak in the field of digital healthcare technology, in particular data analytics capabilities in a post-COVID world, thanks to AI. For the neutral observer, the new coronavirus poses an almost impossible challenge to healthcare professionals. Medical experts and policymakers are charged with ensuring that minimum harm is caused by the outbreak. It is anticipated that the magnitude of the work ahead will only be minimized with the aid of artificial intelligence or AI and other emerging and disruptive technologies. We really should not, however, get ahead of ourselves. It goes without saying that the best long-term solution to the virus will take time and patience. AI is not a magic bullet solution, and we need to be cautious about its existing capabilities. Having said that, there is no question that AI has helped us to understand what we are up against and how we can find a solution to this pandemic. The foundations have already been laid for AI to create the way for us to reduce potential infections and to find the best solution to the extermination of the virus. I truly expect this content to be really knowledgeable for you. If it had been, please thumbs it up, share it, and of course, as I always request, do subscribe. Thanks for watching, and I'll see you in my next video.